Ever wondered what a bronchoscopy is and when it's needed? Well, let's take a few moments to explore this fascinating medical procedure. Bronchoscopy is a procedure that gives doctors a close-up view of your lungs and air passages. Think of it as a guided tour down your windpipe. It's done using a bronchoscope, a thin tube equipped with a tiny camera and light. Now, why would someone need such an in-depth peek? Bronchoscopy is a pretty common procedure, often used in the diagnosis, treatment, and monitoring of lung diseases. Whether it's a persistent cough that's been bothering you or a suspicious spot seen on a chest X-ray, bronchoscopy can be a valuable tool in figuring out what's going on. Intriguing, isn't it? But we're just getting started. So now that we know what a bronchoscopy is, let's delve into when it becomes necessary. You might be wondering, when exactly is a bronchoscopy needed? Well, a variety of conditions and symptoms may necessitate this procedure. One of the most common reasons is a persistent cough that just doesn't seem to go away. This could be a sign of an underlying issue that needs to be investigated. Infections in the lungs or airways may also require a bronchoscopy for diagnosis. It allows doctors to obtain samples for testing, helping them to identify the type of infection present. Likewise, if a tumor is suspected in the lungs, a bronchoscopy can be used to obtain tissue samples for further analysis. Chronic lung diseases such as chronic obstructive pulmonary disease or COPD and interstitial lung disease are other conditions where bronchoscopy can be useful. And lastly, if you have unexplained lung problems, a bronchoscopy might be the best way to find out what's going on. So, if you're experiencing any of these symptoms, a bronchoscopy might be in your future. But how does one prepare for such a procedure? Preparation is key to any medical procedure, and bronchoscopy is no exception. When it comes to gearing up for a bronchoscopy, a few simple steps can help ensure the process goes as smoothly as possible. First off, fasting is important. This means no food or drink, except for small sips of water, for at least 6 hours before the procedure. This helps to reduce the risk of aspiration during the bronchoscopy. The next thing to consider is your medication. Certain medications could potentially increase the risk of complications during the procedure. Therefore, it is crucial to discuss your medication regimen with your doctor ahead of time. They may advise you to avoid some medications, especially those that can thin your blood, until after the bronchoscopy. Don't forget to arrange transportation, since you'll likely be given a sedative for the procedure. It's essential to have a friend or family member drive you home afterwards. Last but certainly not least, make sure to inform your doctor about any allergies or existing medical conditions you may have. This includes any known allergies to medications, or if you have conditions like heart disease or lung disease. The more your healthcare team knows about your health history, the better they can tailor the procedure to meet your needs. With proper preparation, you can ensure a smooth procedure and a quick recovery. Now that we've covered the preparation, let's talk about the bronchoscopy procedure itself. The process begins with the application of local anesthesia. This is usually administered as a spray to numb the throat, reducing discomfort and suppressing the gag reflex. Sometimes, a sedative might also be given to help you relax. Next comes the insertion of the bronchoscope. This is a thin, flexible tube equipped with a light and a small camera, which is gently guided through the nose or mouth, down the windpipe and into the lungs. As the bronchoscope navigates the airways, the camera sends back live images, allowing the doctor to closely examine the lungs and airways. If necessary, tiny tools can be passed through the bronchoscope to collect tissue samples, known as biopsies, for further analysis, and that's it. That's what happens during a bronchoscopy. Before we wrap up, let's quickly summarize the key points about bronchoscopy. Bronchoscopy is a diagnostic procedure allowing doctors to examine the lungs and airways. It's often indicated for persistent coughs, unexplained lung problems, or to diagnose lung diseases. Preparing for this procedure involves fasting and discussing medications with your healthcare provider. The procedure itself involves inserting a bronchoscope through the nose or mouth into the lungs. Remember, knowledge is power, especially when it comes to your health. Stay informed and stay healthy.
Thanks for watching Body Blaster Insights. If you enjoyed today's insights, give it a thumbs up, share, and subscribe for more. Drop your thoughts in the comments, and let's build a positive community together. Stay motivated, stay positive, and keep thriving.